Technology glitches. Just got to give this 1 second here. Okay, so we are live on YouTube. I will go ahead and share my screen. Okay, all right. So thank you guys all for being here with us today. My name is Katie Lindstrom. I am the director of the Health Department in Pacific County. Also jumping in on the presentation today will be Stephanie Michael, and she is our lead for our COVID response for the county, and she's a health program manager with the department as well. So we'll go ahead and jump in. There's a couple primary goals with the training today. First, we want to share with you a little bit about the data and decision-making process in terms of recommendations for in-person school or online school. And then we want to go over the health and safety guidelines that are being put out by OSPI and LNI that are going to apply to school once you guys do return to in-person school. So first, we'll start out with sort of that decision tree and guidance that the state put out in terms of making recommendations for in-person school. If you want to read the full document, it's about a 6-page document with lots of information. You can go to this website here and get the whole document. I'm going to give you guys sort of the quick overview. So basically, there's 3 steps that counties and schools need to look at when making recommendations about in-person school, online school, or hybrid. The first thing that counties and schools need to look at is the data. So we need to look at the case rate. The data that the state has chosen is the number of cases per 100,000 population over 14 days. So, and I'll show you in a minute where you can find that data. But basically, schools and communities fall into one of 3 categories. Your high risk category, if you are greater than 75 cases per 100,000 population over 14 days. You are in the moderate risk category if your case rate is between 25 and 75, and you're in the low risk category if you have fewer than 25 cases. So that's step 1, is you determine which category do we fall into. We actually are currently in the green category over here. That just changed within the last about week and a half. Prior to that, we actually were in the red category. We were really high. We were almost up to over 100 cases per 100,000. So we were very high. Over the last week and a half or so, our case rate has started to go down, which is amazing. And we are very hopeful it continues to do that. But we are currently, as of today, in this green category. However, we want to see the county stay in that green category for a 3-week period before you kind of change that recommendation. So just to continue with the chart, once you determine which category you're in, there is a recommendation for education modality and then also extracurricular activities. The education modality is going to be a recommendation about should we be all online? Should we be a hybrid mix of the 2, or should we go back fully in person? So in the red category, it's a strong recommendation for all distance learning, except for very high risk students, maybe special ed kids or kids who are homeless or kids with connectivity issues. In the moderate risk category, we're still recommending distance learning, but this is where you start considering maybe adding in elementary kids, kind of on an A-day, B-day sort of schedule. And over time, adding in middle and high school students in a hybrid model. In the green category, this is where the recommendation is for in-person schooling, especially for elementary kids. Again, needing to cohort and keep the class sizes small. But this is where you start looking at bringing kids back in person. And again, over time, getting those middle and high schoolers back into school as well. Extracurriculars, depending on risk category, are strongly recommended to be postponed or canceled in the high and moderate risk. And then once you get over to the green category, that's when you start looking at some of those lower risk extracurriculars and phasing those back in. Now, it's important to remember, this is just step 1. Once you've determined kind of which risk category you're in, and then determining which type of education modality you're going to move towards, you also have to do things in step 2 and 3. So Step 2 is really about health and safety planning. Does the school have policies and practices in place to ensure the health and safety of all students and staff? This is going to include policies around transportation, drop-off, pickup, plans to cohort students. And this is going to be physical distancing in the classes. So not having more kids than you can physically distance and fit within the square footage of your school. This is where that A-Day, B-Day cohorting comes into place. Promoting frequent hand washing and cleaning, also requiring that face coverings are worn by all staff, students, and visitors. And then looking at your ventilation to ensure that you're creating very fresh air, having windows open, having ventilation set up in a way so that fresh air is constantly being recirculated back into the school. So once you've done step 2, then you're also going to go to step 3. Step 3 is really looking at the healthcare system and the school readiness to respond to a potential outbreak. So hopefully this doesn't happen, but if it were to happen that you had a positive case in your school or multiple cases in your school, the school needs to ensure that they are able to respond to that. So what goes into that is daily monitoring of symptoms. So that's screening of students and staff every single day. Also having plans in place to manage kids or staff who get sick while at school. This would be having an isolation room and or plans to immediately send kids home should they have any COVID symptoms. With the health department, we're looking at, do we have adequate testing? So health department and our healthcare providers, is there adequate testing capacity in the community to respond to an outbreak? If there were an outbreak at the school, it would then involve a lot of testing of other students and staff who are identified as close contacts. So it's important that the system is able to meet that demand. Also, does the health department have the ability to investigate, quarantine, and isolate all potential positive cases, as well as close contacts of cases? And then finally, the health department and the schools really need to work together to sort of continuously monitor the data. And that's something we have been doing. We've been meeting weekly all summer with the superintendents and some of the principals. And part of that is looking at that data each week and making sure that things are trending in the correct direction for whatever modality the schools are in. So once you've kind of gone through all 3 of those steps, that is when you would then look at implementing some in-person learning. So really just wanted to give you an overview of what all kind of goes into that decision. Bottom line, it is up to your school district, your school board. So your school board would be the final vote on that. The health department would be making recommendations though, based on this process. Any questions on this before we move on to the health and safety plan?
The school board gets bullied by, who was it? Not the healthcare authority, but
I can't tell if someone's asking a question. It's pretty quiet. Was there a question? Okay, I'm sorry about that if there was. You can also chat your questions into the chat box and we can answer those that way as well. All right, so moving on. Oh, I'm sorry. I told you I was going to tell you where to find the data. So if you want the quick, very easy way to find the case rate per 100,000, you can go to pacificcountycovid19.com. You scroll down to the second data dashboard that is on that landing page. You're going to want to select Pacific County from this drop-down list. And then you go to the phase and risk assessment tab and it will show you the rate per 100,000. It's also going to show you sort of the trend data. So this is the line here. It's going to show you that trend over the last, actually it goes all the way back to March. This orange dotted line here is 25 cases. So that's what we want to stay down below. This screenshot was from a couple weeks ago and you can see we had a pretty high case rate a couple weeks ago up here. This was 97 cases per 100,000. But as of today, we're actually down back below this, this kind of below 25 case rate, which is great. This is the way to do it if you just want to crunch the numbers. Just take 100,000 divided by the county's population, You multiply that number by the total number of cases within the last 14 days, and that will give you the case rate per 100,000. Might be a good exercise to do with your kids in math to teach them a little bit about real life data.
Katie, one thing I should mention is the data does tend to lag 3 days or so. So just keep that in mind when you're looking at it. It'll tell you when it is accurate too, up in the top right corner.
Yes, good point. So when you hover over that trend line, it'll actually tell you the date range that that data point is good for. If you ever need like the most up-to-date data, the health department, we actually have that because we do provide the data to the state. So we have up to the minute data. The state is usually 2 to 3 days kind of lagged behind. Thank you. All right, so the next section is going to be the health and safety plan. These are the required components that OSPI put out for all school districts for when they do resume in-person learning. This is sort of the outline. I'll just go ahead and jump in here. The first section is going to be about face coverings. It is a requirement from OSPI that all students, staff, and visitors wear cloth face coverings while on school premises. This is a requirement. There's really not a lot of wiggle room here. When we're talking about face coverings, the strong preference is a cloth face covering that correctly fits, you know, the whole thing. This is a requirement actually from OSPI. It's also a requirement from LNI because the school district is also a workplace. The LNI requirement around workers wearing face coverings also overlays. So you guys kind of have those two requirements for the face coverings. Let's see here. The district, I believe, is going to be providing face masks. Steve, is that correct? I think we got you guys a big stash of those.
Yeah, we have many face masks. All the offices have a good supply.
Excellent. So it'll be great if students can take those home or you know, be assigned face masks, having extras, things like that. In very limited circumstances and on a case-by-case basis, students or staff may be authorized to use a face shield in lieu of a face mask. The reasons for this could be a documented health condition, and it's a pretty narrow list really of what those health conditions are. It also could be for students who are deaf or hard of hearing and who need to read lips, or if a teacher is teaching something where students need to be able to see the teacher's mouth, like reading or you know, different things like with pronunciation. Those would be times when a face shield could be used. It's important to remember to clean the face masks and face shields between uses. And then just kind of in an attempt to increase compliance with face mask wearing, face mask breaks will be allowed to be taken outside as long as social distancing is maintained. So that's something that you'd want to work with your administration on, specifically in terms of process and where that would be. So continuing on with this, the medical exceptions should be addressed with your supervisor. So if you need that, you need to talk to your building supervisor. If you are wearing a face shield as an exemption, they need to be the type that goes down below the chin. It needs to not have a gap at the top, and it should be worn with a cape, which is a kind of a cloth attachment that attaches to the bottom of the face mask, and it covers down to the shoulders to sort of seal in that gap. Children under 2 shouldn't wear face masks. Anyone who's deaf or hard of hearing, I already mentioned that. And then anybody who isn't able to take a face mask off on their own, those are people who shouldn't be wearing face masks. And then younger students should be supervised and taught how to put on and take off a face mask properly. And then even when we're wearing face masks, we still need to continue to practice physical distancing. So this is sort of what steps should be taken if a student will not wear a face covering. So again, persons with documented medical conditions could have the exemption to wear a face shield. Students who are not exempt but refuse to wear a mask will receive school remote schooling. So that's kind of the accommodation there.
Katie?
Yep.
If we're alone if a teacher is alone in their classroom or I'm alone in my office, do we still need to have a face mask?
No, if you're alone in your classroom, like with the shut door, you can take the face mask off. But if somebody else is in the classroom with you, even if you're maintaining 6 feet distancing, you still need to have the mask on. Good question. Okay, so this is just kind of a quick why to the face masks. The face masks are required because of how COVID is spread. It's principally spread by droplets that you exhale when you're speaking, even just when you're breathing, singing, coughing, obviously sneezing. Those droplets, and we're going to show you a video here in a minute, actually linger in the air for up to 3 hours is what they found. And even if a person doesn't know they're sick, if they have COVID, those droplets could infect other people who come into contact with those. So this is why we're really stressing the face mask, number one, because those do tend to drastically reduce the amount of droplets that a person expels into the air. It tends to catch most of the droplets. Also why we really are pushing the physical distancing, because those droplets do sort of have an area where they go and stay. And if we stay out of each other's sort of bubbles, it can definitely decrease our chance of picking something up. There's a lot of bad information out there on the internet, but we just want to make sure people understand there's not any documented health or safety risks to wearing a mask other than some very extreme and kind of rare circumstances, but there's no danger in wearing one in terms of, breathing in your own CO2 or anything like that. They're not going to cause harm that way. I'm going to go ahead and have Stephanie play the video here. So I will stop sharing. We have a video that's going to show sort of the effectiveness of face masks in terms of keeping bacteria and viruses at bay.
Well, last week, Washington State put a mask mandate in place requiring individuals to wear a face covering in indoor spaces, and also requires face coverings outdoors when people can't stay 6 feet apart. The mandate is in place to prevent the spread of coronavirus. Well, there's still a lot we don't know about this virus. What we do know is that it spreads through droplets. So we wanted to know, how effective are masks when it comes to stopping them? Our Kevin Kim got an exclusive access to a lab in Spokane to test it out for himself. Full disclosure, this demonstration just looks at droplets, not specifically the coronavirus. But if you keep in mind how this virus spreads, the results may surprise you.
From blue polos to blue lab coats and gloves, we headed down to Sacred Heart's laboratory to unmask a common question. What exactly does a mask do? So we teamed up with the hospital's microbiology director, Dr. Rich Davis.
This one will be no mask.
It's a demonstration of where respiratory droplets go and how easy they are to transmit, and how a mask is effective at blocking those. That's really the key takeaway.
Here's how this demonstration worked. I had a petri dish in front of my face as if it's another person's face. Then, with and without a mask, I talked.
Hey, how you doing?
Sang.
Somebody once told me the world is gonna roll me.
Coughed. And sneezed. We also tried coughing with and without a mask from 2 feet away, 4 feet away, and 6 feet away. Dr. Davis put the dishes in an incubator, and we waited 24 hours for our results.
So these are the plates that you were interacting with yesterday, with or without a mask.
Let's start with the face-to-face demonstration. Mask on the left, no mask on the right. Let's go with talking first.
Look a mask. Oh, that looks good. Talking without a... Oh, okay. I'm actually shocked there's any at all. I'm going to be completely honest with you.
Next up, singing.
This was Changes by Tupac, and this was Smash Mouth.
Things will never be the same, never be the same, yeah, yeah, yeah.
Pretty similar to talking. But Dr. Davis brought up a good point about one of nightlife's most popular activities.
Like karaoke night, when that microphone after the night, I'm sure it's pretty gross and wet. So now we've got coughing. So this was just two coughs.
Really? That's crazy.
Remember, all those yellow dots, that's where bacteria grew after the droplets out of my mouth landed there. But those droplets were nothing compared to the ones from sneezing. First, mask on.
What? Okay, I'm terrified to look at this one. This is no mask. Ooh! Oh. Good Lord.
When I had my mask on, no yellow dots. But when I didn't, there was always something.
What this kind of goes to show is that most of those, heavy fat droplets that are going to come out of your mouth, that are going to have bacteria, they're going to have viruses potentially, they're going to get caught and not go forward into, the space in front of you.
It was the same case for the social distancing demonstration.
So yesterday I was standing right here.
No mask with a mask. 4 feet, you can see it's less, but still pretty prevalent. 6 feet.
Oh, okay.
Yeah, it's just one or two few up there. So there really is that distance difference where the droplets that you're producing by coughing are pretty much, a lot of them are falling out of the air. To me, I think we're coming into a new reality where masks fit into that very social conscious paradigm. You do simple things that everyone can do. It's not going to be 100% effective, but if we all do it, it's going to definitely make a difference in preventing things from spreading one person to another.
Very.
All right, thanks, Stephanie. So it's kind of a little bit of a gross demonstration, but I think it's pretty effective in showing how the masks can really decrease that risk. So I'll go ahead and share my screen again here. Share. Okay, so from current slide. Okay, so just another graphic here about the risk of infection in various situations. The person on the left here does not, or has COVID. Person on the right here is healthy. And then in the first scenario, neither person are wearing a mask, neither are, and they're both closer than 6 feet. The second scenario, just the healthy person is wearing the mask. Third scenario, the sick person is wearing the mask. Fourth scenario, both are wearing the mask, but they're still closer than 6 feet. And the best scenario here down is when both people are wearing masks and the distance is greater than 6 feet. You can see that the risk goes from very high in this first situation down to very low. And then of course, not realistic probably forever, but virtually no risk if you stay home. So I did see a question in the chat box about masks and just some information about what you need to look at when you're choosing your mask. They really should have 2 or more layers of washable, breathable fabric. They really need to completely cover your nose. You see a lot of people wearing them down below their nose. That's not going to be very effective in stopping droplets, especially if you sneeze. They should fit snugly against the side of your face and not have any gaps. Don't choose masks that are made of fabric that make it hard to breathe, like vinyl. I'm sure it's out there. Have exhalation valves or vents which allow virus to escape. That kind of defeats the purpose of keeping your germs to yourself. And then also the masks that are intended for healthcare workers, like N95 masks or respirators. Some tips to get kids to wear masks. I'm sure as educators, you guys are aware of these different types of strategies, but it's worth noting. It's a new and could be a little bit scary thing for kids to wear a mask. So just explaining it and teaching kids about why it's important and what it's going to do. Giving kids a choice and making it fun. Let them decorate their mask, pick out which color mask they want to wear. Also having them practice, put the mask on and take it off correctly. It's not actually super innate just to know how to do that correctly without being taught. And then just be a role model. So when you're wearing a mask, it's going to increase kids' compliance with wearing masks because they see adults being good role models. All right, any questions on masks before we move on?
Katie, how about the light blue disposable masks that are so common?
Those are fine. Yeah, if you need to hand those out to visitors or if a kid doesn't have a mask, those are okay to use.
Kate, it looks like we have one chat about why not N95s. First, N95s to be properly used have to have a fit test completed. That's generally done as part of that with healthcare workers, EMS, those types of first responders. Also, it just kind of makes sure that those stocks are available for those healthcare and frontline workers that really do need that protection when they're doing things like an aerosolizing procedure where that risk is significantly greater. And so those quality of masks need to be in those areas of usage.
Yep. All right, any other questions on masks before we move on? Okay, so the next section here is on screening and symptom check. It is a requirement, again, from OSPI that all students and staff are screened for symptoms every day before they come to school or when they get to school. It can be done in a couple different ways. There can be, parents can attest on a form where they just sign an initial, my student doesn't have any of these symptoms, and that would be returned each day. You can do the screening at school with a staff person screening each student. And I'll let Dave or Steve, if you want to jump in. Are you going to use the app? Is that something you're planning to do?
We are not using the app. No, as we looked at, we think it would leave so many holes that we might as well just do it personally anyway.
Okay, so I think a good strategy a lot of schools are doing is trying to get as many parents to return the attestation form as possible, and then that way the in-person at-school training can screening can just be for those kids that parents didn't return the form. Let's see, is there anything else? Oh, staff are also going to need to be screened each day. They can do their own screening where you just sign in on a clipboard that you don't have any of these symptoms, you don't have a fever. And staff can do their own, but students do need to be screened by an adult. This is an example of the attestation form that parents would use. So the list of symptoms that we want to check for each day. One that's really important to note is this one right here, congestion or runny nose, as long as it's not related to seasonal allergies. So if it is an allergy related congestion or runny nose, that would be okay for the student to be in school. But if it's not related to allergies, that would be a reason that a student would need to be excluded from school. You're also going to ask if anyone else in the household has any of those symptoms. If your student has been in close contact with anyone with suspected or confirmed COVID, have they taken any medication to reduce the fever? So, if they don't have a fever, but it's because they took Tylenol, they still need to stay home. They need to have no fever without any kind of medication. If they answer yes to any of those questions, they need to be excluded from school. It's going to be really important that kids are not, and staff are not coming to school sick this year. This is the same document, but just an on-site version of that same document. This is a flow chart that kind of talks about who's going to be excluded based on how that screening happens, and then when they can return from school. So the first one over here is no symptoms, no diagnosis, no close contacts. That's green light, you can go to school. Second is no symptoms. Actually, both of these are no symptoms, but you have a close contact. You are a close contact of someone with COVID. In this situation, you're going to be on quarantine from public health and not allowed actually out of quarantine for 14 days. So definitely cannot be in school if you are a close contact. If you have no symptoms and you've tested positive, also, you're going to be on isolation from mandatory isolation from the health department. You cannot be in school for 10 days at a minimum. It depends on how sick you are and some other details. If you have one or more COVID symptoms and you've tested negative for COVID, you can't go to school until 24 hours have passed since you don't have a fever and your symptoms have improved. And that is no fever, without using a fever reducing medication. If you have one or more COVID symptoms and you've either tested positive or you did not have a test, then you actually can't return to school until 10 days have passed after your symptoms started and 24 hours have passed since fever is resolved without medication and symptoms have improved. So this is probably a handy flow chart that you might want to keep just to kind of figure out what that exclusion looks like and when kids can return to school or staff. So this is just some school specific information. Isolation for students with symptoms is going to be in the office near the staff bathrooms, and then at the high school it'll be in the conference room. Any questions on screening or symptom check? Can you monitor the chat box, Stephanie? I have a hard time having that many windows open.
Got it.
Okay. So the next section here is hygiene practices. The first thing with hygiene is we want to make sure we're staying home if we're sick. Very, very important. Second, and probably it's up there, it might be the most important hygiene practice, is washing our hands. We're going to wash hands more frequently than we normally would. And we're going to be encouraging students to wash hands more frequently than they normally would. We need to be teaching young children how to wash hands correctly. It's not actually as innate as you'd think. A lot of them do it and they don't do it for long enough. They're not using enough water, soap, that sort of thing. Also teaching kids to not touch their eyes, nose, and mouth, just in general, so we're not spreading germs to ourselves. If soap and water is not available, alcohol-based hand sanitizer is an acceptable alternative. It's not ideal though. Hand washing with soap and water is going to be kind of the gold standard there. And then of course, teaching kids how to cover their sneezes and cough, either with the tissue or sneezing into their elbow and not sneezing into their hands. And then definitely washing your hands after you sneeze regardless. We can print some of these signs up for you if you'd like. This is just one example of sort of, you know, how to wash your hands. You could post this in the kids' bathrooms, that kind of a thing, or above any sinks that you have. Another example of a sign that you can post. A lot of people don't realize how long 20 seconds is, but there's lots of examples of different songs. This is Bohemian Rhapsody. If you sing it in your head through this amount of lyric, that's about 20 seconds. Just a good way to kind of remember to actually do it correctly. So physical distancing is the next. This again is going to be a requirement by the state. I'm going to have Stephanie show the micro droplets video, and then I'll talk about what their actual requirements are for the school district.
About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the micro droplets, shown in red, continue to drift. This simulation uses only micro droplets. 5 minutes later, 10 minutes later, 20 minutes later, the micro droplets are still floating in place.
空気がよどんでいると、つまり空気の流れがないということで、マイクロ飛沫そのものは、落ちたり、違う場所に動くことはできませんので、長時間その場所にとどまるっていうことになります。
But there is a way to prevent this stagnation of micro droplets. Opening windows and increasing air circulation is believed to be effective. When you open a window, micro droplets are quickly swept away. They're very small and light, so any airflow will get rid of them.
できればですね、2箇所開けて風の流れを作ってあげるということが大事。それが1時間に1回でもいいから、そういうようなことをやることによって感染のリスクっていうのはかなり下げることができるようになるんじゃないかなというふうに思います。
All right, thank you, Stephanie. Before we go back to the presentation, I do see a question here. Are there resources, audio and printed, to provide to our native speaking families regarding these informative COVID topics? Yes, we can definitely get you information. The State Department of Health has put almost all of these educational materials out in multiple languages. So if you guys just want to let us know what those languages are, we can get you Spanish materials or Laotian, whatever languages you find useful for your school. So just let us know what you need. We can get you that. All right, let's go back over here to share. Not sure why this keeps going back to this. Okay, we did hiding. Okay, so physical distancing. Physical distancing is a requirement set out by OSPI. The school needs to kind of assess their square footage and determine how many kids can be on campus at any given time. Classrooms are going to need to be set up in a way where desks are spaced at least 6 feet apart. Also hallways, flows of traffic, things like that. Lunchrooms, all are going to need to be set up with social distancing in mind. Looking at a minimum of a 6-foot distancing between people at all times. This is just kind of show, based on some research, this was not done in the US, you can tell it's in meters, but when distancing is in place, there's about a 12.8% chance of infection or transmission. And when distancing is in place, it reduces that down to 2.6% chance of transmission. So let me get here. All right, so just in terms of the school, I think I already talked about some of this, but other things to consider is canceling field trips, assemblies, or large gatherings, Christmas concerts, things like that, or making significant modifications so that you can ensure that that physical distancing is happening. It is important to note that social gatherings, events are still limited as part of phase 3 in Pacific County. So you'd want to keep those guidelines in mind as well. Staggering your arrival or dismissal times, limiting at drop-off so there's not congestion at drop-off in the morning. Those are all social distancing strategies that can be put into play. Let's see, limiting non-essential visitors, volunteers in the classroom, really limiting the number of people who don't absolutely need to be on campus, limiting them from being there. Also cross-school transfer special programs. I'm not sure how much you guys do this anymore, but it'd probably be wise to limit that this year, at least initially, when you get back up and going. The other thing is, you know, as the weather allows, if you can teach outside, do classroom activities outside, there's a much lower risk of transmitting COVID when you're outdoors versus indoors. So, you know, right now and hopefully for another couple months, weather should hopefully allow for that. So we'd encourage that as much as possible. All right, the next section here is meals. So meals, we're looking at definitely having assigned seating in the lunchroom or having lunches in the classrooms to limit the amount of interaction between classes of kids, having brown bag lunches or sort of plated up meals for kids, you know, staggering the number of groups who are in the lunchroom at one time, looking at your flow of traffic within the lunchroom to ensure that you're not having a lot of mingling or crowds of kids in the lunchrooms, spacing your tables 6 feet apart. Students shouldn't touch utensils. So things like salad bars are probably not going to be a good idea initially. And staff really should be plating up the students' lunches. And of course, we're going to clean and sanitize tables between each group.
Call it good. I could
All right.
swear.
I'm not sure. Okay. All right. So next up is transportation and drop off. Again, this you'll notice a theme, but we're going to implement strategies to really minimize the amount of close contact between students. You're going to look at assigned seating, having kids sitting either with family members or members of their classroom. That way we're not introducing additional close contacts for that student. When possible, really encouraging kids to walk, bike, or be driven to school. Let's see, distancing. So again, when possible, if space allows, having space between the seats, just so we're not as crammed in. Buses should be cleaned and disinfected frequently, paying special attention to any high touch surface like the bar that you use to get in or the top of the bus seat. The district could reconsider bus routes to ensure that the furthest pickups and drop-offs have the fewest students on the bus. Let's see, was there anything else? Oh, the other is encouraging having windows down. So again, to kind of keep that fresh air flowing in and out of the buses, it's going to be a good strategy as well, as weather allows. All right, cleaning and disinfecting. We get a lot of questions about how long does COVID live on different surfaces. What we generally say is the primary way that COVID is spread is person to person through those droplets. So this is the one that is going to be the vast majority of risk is the air. COVID has been shown to live in the air for up to 3 hours. It is possible, however, to touch a surface that has COVID on it and then touch your face and infect yourself that way. So copper has been shown for about 4 hours, cardboard up to 24 hours. Those smooth surfaces like stainless steel or plastic is where it's going to be live the longest, and that's up to 2 to 3 days. This was published in New England Journal of Medicine, and I'll show you here some charts for people who are very into the science and the study part. This just shows the different surfaces, how long COVID lived, and how much virus was still sort of viable over time. So you can see that it tends to become less viable over time, but still detectable after a certain number of days on these different surfaces. Might be a good chart to share with the science class. All right, cleaning and disinfecting primarily is, the job of your janitorial staff, but this year it's important that we're all doing additional cleaning, especially of our own workspaces. So wiping down our phones, our desk area. And when we're cleaning, we want to make sure to use the proper disinfectant. Most disinfectants that you can purchase in the store are going to be effective at killing COVID, but just you need to make sure you're using them correctly. You're not just sort of spraying it on and wiping it off. You're actually spraying it, letting it sit for however long the instructions say to let it sit, and then wiping it off. That's how you're going to know that the bacteria and viruses are actually being killed. Let's see, you want to make sure that you're airing out the space, having windows open, things like that when you're cleaning. We don't recommend the use of fogging machines or fumigation machines. They can actually be harmful to people. Yeah, and just following the instructions. There's not anything special about COVID that makes it extra virulent or more likely to live than most other viruses or bacteria. So generally speaking, standard household cleaners are going to do the trick as long as you're using them correctly. When you're thinking about cleaning, you really want to think about high touch surfaces like doorknobs, cleaning those multiple times a day, phones, maybe the counter, the checkout counter or the check-in counter at the office, shared restrooms, drinking fountains, your electronic equipment, athletic equipment between uses. You want to make sure that gets disinfected and cleaned between uses. We already talked about buses, and then of course playgrounds. So these are all high use areas in school settings. In terms of washing items, COVID does live on clothing and other material, not as long as a smooth surface, but it is important that if you're cleaning up, especially doing laundry after a confirmed case, that you're going to be wearing gloves and PPE when you do the laundry. You don't want to shake it out because that could stir up the virus and kind of make it aerosolized. Generally speaking, follow the instructions on the tag, but the hotter the water, the better. Bleach if you can, if the material allows, otherwise regular laundry detergent for washing. Ventilation systems we talked about a little bit. There are no, currently there's no recommendations regarding like UV light systems or any sort of thing like that. We don't think it probably hurts, but the main thing that they really want to focus on with ventilation is ensuring as constant of a flow of fresh air coming into the building as possible. If that means you can open windows, then great. Sometimes ventilation and HVAC, opening windows kind of screws things up. So you're going to really want to talk to your administration about that and what's allowed within your buildings. If you'd like additional cleaning information, this one in particular is a guide for schools. It talks about safer cleaning materials, things like that, because you are working around kids, and it has a ton more detail. So for anyone who really wants to dive in, any of these links will get you there. And we will share this presentation to have sent out to you all for reference after the presentation here. In terms of cleaning logistics at the school, the rooms that are in use will be cleaned and disinfected nightly, includes classrooms, offices, and common areas. Buses will be cleaned daily, and sports teams are going to be required to have a safety plan that's individualized to their sport. All right, management of COVID cases or a potential outbreak. We are very hopeful this never comes up, but if it does, we wanted to share with you what that might look like. First of all, the health department would get involved if anybody at the school tested positive for COVID. And the level of our involvement would sort of depend on the situation. If there is just one student and it's an isolated case, that's going to be handled differently than if it's multiple students or staff who have tested positive and we can trace it to actually having spread at the school. It's going to be handled differently. But first of all, just start out with, if someone develops signs or symptoms of COVID, the really important things to remember is you want to separate that person away from other people, just right off the bat. If it's a staff person, send them home. If it's I'm sorry, my doorbell rang. If it's a staff person, send them home. If it's a student, have their parents come and get them. You're going to want to put them in an isolation room as soon as you can. Just keep them away from other kids. And okay, while they're waiting at the school, I'm sorry, you're going to want to make sure they're wearing a face mask. And then after they leave, you're going to want to air out the room that they were in and make sure it gets a good deep clean. Stephanie, do you want to talk about this? I'm sorry, I need to go get the door so they don't ring again. But you want to talk about this slide real quick?
Yeah. Oh, shoot. Sharing the community spread. So as Katie kind of alluded, based on case investigations from positive cases that we get, really can look very different. And that's really that determining where the spread originated. Did it happen within the school environment, or did that family potentially do some travel and then they tested positive without having to go into the school environment? So again, just depending on where those requirements are will really take us to our next steps. There's some recommendation around, if there is that community spread within the school, we have multiple cases, we can link them together or not link them together, that there might be a opportunity to kind of do the 2 to 5 day closure. What that will allow is us to really get those lists of close contacts, get people tested and see where that spread looks. If it can be something that's relatively contained within the close contact cohort of maybe that one classroom, that's going to look very different than the recommendation for if it's pretty widespread through the whole school, and what the follow-on basically 2 weeks will potentially look like for closure for any of those close contacts. So the biggest thing is that communication piece with public health. For the most part, we will be informed of those positive cases probably before the school, but if it happens in reverse, if a staff member ends up has an address maybe in another location where that might be where their positive test is identified. We have that not so much maybe with Raymond, but in some of the more border like Nacelle and Wahkiakum, and then some of the school north that is in Grays Harbor, there's some confusion sometimes there when we are splitting cases to where they truly belong. But if it impacts the school, that's definitely where public health will be involved to walk through and really figure out what the best plan is for the school at that time and the recommendations.
Thank you, Stephanie. All right. So she kind of already talked through these slides. I'm not going to read them in detail, but bottom line, coordinate with public health. We will provide lots of guidance, work with your administration to come up with a plan. Of course, once it happens, one step is going to be a deep clean of the school. That can happen during that sort of 2 to 5 day closure to assess the situation. There may be an extended school dismissal. Again, it really depends on the scenario. If it's a fairly widespread outbreak, then it's probably going to involve shutting the school down for a couple weeks or potentially more, depending on the situation. Returning to school once after either an outbreak or if somebody just has had an isolated case of COVID, the requirements in terms of returning to school, this was also in that flow chart that I showed you earlier, but there is a requirement that you're at least 3 days, 24 hours. Stephanie, 3 days or 24 hours?
24 hours for
Okay.
without fever.
All right, I changed the 24. I did not say the 3. So it's at least 1 day, 24 hours has passed since recovery. And that's defined as no fever without the use of medications and your symptoms are improving. Or also at least 10 days have passed since signs first showed up, or it has been at least 3 days since recovery and a healthcare provider certified that you do not have suspected or confirmed COVID.
Quick, so within the school environment, we recognize that the close proximity in a congregate working or congregate living kind of thing, public health, we actually will clear people to return. Our public health nurse calls it the get out of jail free card. So that's, again, when those people have either finished up potential isolation as of a positive case or out of their quarantine as what would probably be a close contact, those letters will be provided, again, as part of returning to a congregate facility.
All right, thank you. So testing availability for you guys in Raymond, your best bet for testing is going to be at the Willapa Harbor Hospital. They do same day results. It's rapid test. It's actually Monday through Thursday. This is Friday, but that just got updated. So Monday through Thursday, you can call with any questions, but it's actually kind of a drive up between 11 and 1. So
12 to 2. They shifted the time too. Sorry.
Oh, 12 to 2. Okay,
Yeah.
there you go. We will update that. You can also call us at the EOC at any time, 875-9407, and we can give you the most up-to-date information about testing. We can tell you the other places to get testing if for some reason the hospital doesn't work out for you. We can get you connected with the pharmacy in Elma or our drive-through event that happens down in Long Beach. The last section here is going to be on high-risk employees. So you are required to kind of have informed consent, I guess, around being a high-risk employee. So I just want to share with you, there's 2 categories that have been identified by the CDC of people who have pre-existing conditions. The first group has been identified as having an increased risk of severe illness should they get COVID. The second group might be at an increased risk. So they think, but it just hasn't been as clearly defined, at least in the literature of science yet. So the first group, you are at an increased risk of severe illness from COVID if you are over the age of 65, if you have cancer, if you have chronic kidney disease, COPD, an immune compromised state from an organ transplant, obesity, which is defined as over 40 BMI, serious heart conditions, sickle cell disease, or type 2 diabetes. So you are at an increased risk if you have one of these conditions. You might be at an increased risk if you have asthma, vascular disease, cystic fibrosis, hypertension, an immune compromised state from the use of like immune suppressing drugs or HIV or use of steroids, neurologic conditions like dementia, liver disease, pregnancy, pulmonary fibrosis, smoking, thalassemia, and type 1 diabetes. It's important to know if you're a high-risk employee. These are sort of those frequently asked questions for high-risk employees. Just going to go through these really quickly here. Can a high-risk employee choose to come to work without additional accommodations? The answer to that is yes, but it needs to be an informed decision. So we're sharing with you right now, if you have one of those conditions, you can self-identify as a high-risk employee. You can choose to work anyway, but it's an informed decision. Can a high-risk employee ask for additional protections? Yes, they can, and the district should follow reasonable accommodations as defined by L&I. So there's guidance that's existed from L&I for many years related to any sort of like health condition or disability where employees need accommodations. The key word on this though is reasonable accommodations. The school needs to do what's reasonable, but if it's something that just doesn't make sense, like you're a teacher and you can't ever be on campus and there's no online positions, it's not a reasonable accommodation at that point to allow you to not be at school where you need to teach kids. Can a high-risk employee ask for alternative work assignments if additional protections cannot be provided? Yes, they can ask. Again, it needs to be a reasonable accommodation. If a high-risk employee cannot be provided additional protections and there are not alternative job assignments, can the employee access eligible forms of leave? And the answer to that is yes. And then our school district's required to provide an accommodation to employees if the employee themselves is not high risk, but they live with somebody who is, and the answer to that is no. And I will go ahead and break. If there's any questions on the last few sections that we just covered, this is actually the end of the slideshow here. So I will stop share. Did we have any other questions in the chat, Stephanie? Came up?
No,
Specific
I don't think
masks.
so.
Okay, I'll just open it up. If you want to unmute yourself, that's fine. Okay, so I think with that, we are done for today. We want to say thank you for sitting with us and listening through the presentation. Also, we want to wish you good luck. We know this is a huge undertaking and a very difficult one to be reopening school under these conditions. We're here to support you guys in whatever you need. Feel free to reach out to us at the at 875-9407 number if you have questions, if you need data, if you need support, if you need help interpreting some legal requirement or new state health order. Please don't hesitate to reach out. We definitely want to support you guys and help you be successful as you get back into school this year. All right, with that, I think we're all done.
All right. Well, thank you very much, Katie.
Yep.
And thank you to all that attended.
All right, thanks. We'll go ahead and end the meeting.
Bye-bye.